Doctors and surgeons of Reddit, what was your this just got even worse moment with your patients? Not a doc, but I used to work for radiology in a small hospital and was their kind of Mr. Everything we don't want to do, lifting, security, transport, babysitter, etc. A young mid-20s couple gets brought in on backboards after a car wreck. The girl gets a bed in the ER. She's mostly fine, beat up quite a bit, but still coherent in talking. A state trooper is in her room with her. The dude is complaining, but overall seems fine. She's asking me to see him and I tell her that they're stabilizing him and he's not going anywhere. She says, what does that mean? Over and over again, and I tell her that he's in a bed on a board, so he can't move. She's freaking out. I take the guy back to radiology, he's talking and joking, things seem fine. We do the court and his spine is broke, not just broke, severed. Guy is in for some serious surgery, rehab, and might never walk again kind of stuff. The girl runs out of the room, cop chases after her, they start fighting. A little 110 pounds girl is straight up squaring up with this big-ass cop. Cop ends up tasering her in the middle of the ER. Her dude is screaming, because they told him about his spine, his girl is now chained to a bed. Turns out they were running drugs, high as eagle balls, flipped the car and the dude probably never walked again. I always wonder though. Patient came into hospital with cystic fibrosis with end-stage lung function, had an infection, but was there to get optimized for a lung transplant. Was transferred to ICU after hemoptysis, and then in ICU had massive hemoptysis and coded. A major artery in his lung had eroded and he was bleeding out into his airway quickly. At any normal hospital, this already is the end. Fortunately he was at an academic tertiary medical center. They coded him for between 50 and 60 minutes before getting ROSC at the same time as massive infusion protocol and cannulating for ECMO. He had no chance at living without the transplant, and even though it was already a long shot, they did the lung transplant while he was on ECMO and after he had been that way for about 10 days with basically no response to stimuli. After another couple weeks with the new lungs, he started to respond and was taken off ECMO. 2 months later, he walked out of the hospital. Had no major deficits a year later at follow-up. In my head he's like seeing a ghost or a zombie. Not a doctor, but I was a forensic technician assisting forensic pathologists at autopsy. One day, the chief and I were doing 3 routine narcotic autopsies. Oftentimes with odds, our doctors would let us, the techs, do the whole evisceration to save time. So all the doc had to do was to examine the individual organs. So on the 3rd decedent, she gave me the green light to start cutting. Once I had the chest plate removed, something didn't look quite right with his lungs. I called over the doc and she takes one look and goes, "Yeah, really, I hope you have your mask on as tight as it can possibly be." Her next words were terrifying: "This tuberculosis." We immediately had to inform the Public Health Commission, kick everyone else out of the autopsy room, and convert our deco room, where we primarily did the exams of decomposed people, and turn on the extra-duty ventilation system and had to complete the exam with the full paper kit on. I had an elderly patient once who went into cardiac arrest and was brought back. She had an extensive workup done, but we never found a great reason for why she arrested. Then, just as she was getting better and had her breathing tube removed, she arrested again. We did CPR and were able to get a pulse back, but she remained super sick all night. We were supporting her heart with a mechanical device and she was on high doses of medications to keep her blood pressure up. We were doing everything possible, but things were not looking good. We ended up calling her elderly husband and asked him to come in as we were worried she would not survive the day. Her husband told us he would be there within the hour. Well, 2 to 3 hours passed and he didn't show up. We tried calling and couldn't reach him. Then somehow someone found out that he was actually in our ER. Turns out he had left his house, fell, and broke his hip. As we hastily tried to arrange a way to get him upstairs from the ER to see his dying wife, she arrested again. We were actively doing CPR as they wheeled her husband on a stretcher in a casted leg to her bedside. at which point he called off the code. Everyone was crying. It was pretty awful. Back when I was in residency, there was a patient who came in for a quick office visit to test the circulation in his legs. It's a really basic test called ankle brachial index, where you basically just put blood pressure cuffs in different spots on the arms and legs to check for atherosclerosis in blood vessels. It should take maybe 15 minutes for the whole thing. So, he's sitting there in a hospital gown and those sweet yellow grippy hospital socks. We run the test and there's some trouble getting a reading in his left ankle. Try again. Still no reading. We're all checking the machine and the blood pressure cuff seal. Finally, someone takes off his sock to see if it was in the way. The sole of his foot was totally black. One of the other residents goes to squeeze his foot and his thumb sinks about 1 inch in. He pulls it out in shock, and about a cup full of liquid gray absolutely rotting flesh starting leaking out. One resident vomits. Another nearly passes out. A battle-axe nurse comes over and goes nope. Get him to vascular. He had necrotizing fasciitis. Ended up having a below-the-knee amputation that night. Nurse here. Midwife let a mom go through over 8 hours of the pushing stage of birth to the point the mom went into severe decompensation, blood pressure plummets, saturation drops, fetal distress, etc. In Canada, midwives practice separately from doctors and nurses. They usually just have an agreement with hospitals to use the beds, although medical care is available if the delivery becomes high risk. Doctors take over and go in for emergency C-section. Realize the arteries in the sides of the uterus are ruptured due to pulling away from the strained uterus and extensive pushing. Baby came out fine, but they had to work on mom. Finally close her up only for mom's pressure to plummet again. They open her back up and realize another artery was bleeding, so they clamped her aorta until they could repair the damage. Her lower body didn't receive blood flow for several minutes. They replaced her blood volume at least 3 times throughout. Finally the team stabilized her but were afraid of anything else unexpected, so they packed her but left the wound open, then sent her to ICU. I received baby in NICU. Baby was okay. Mom survived, although didn't find out much more. EMT. We had a man in his late 40s that lived with his mother in a rundown trailer, out in the middle of the country, that first called us to have us check on his hyperglycemia. He was getting 450 milligrams, which is the highest my partner Aurora have even seen, and advised him to go to the hospital. He was morbidly obese and wasn't taking care of his type 2 diabetes in even the slightest. He refused any attempt to have EMS transportation to her. We couldn't force him into the ambulance, so we had no choice but to leave him, but advised our medical control, doctor in charge, of the incident as soon as we got back into the ambulance. 2 months later, we get a call back to his trailer by a third-party caller, again for his diabetes. This time his feet have gangrene and we can see the exposed bones of his toe. I mean, all 10 of his toes have had the soft tissue eaten away down to just the bone. This time he wasn't the least bit hesitant, but we still can't believe he had gone 2 weeks like this. Had a patient call our clinic saying he had cut his hand and needed a couple of stitches. Sure, come on in, I'll stitch you up. Failed to mention until I got in the exam room, that he was working with a table saw. And that he had nearly cut 3 fingers off. Tendons were exposed and severed, bone visible. Sent him immediately to the hospital. They had to call in a hand fellow after hours to try to salvage his hand, which they were able to do fortunately. Had a young, mid-30s, patient with metastatic cancer, that spread to other sites in the body, including both proximal femurs, hip bones, and the pelvis. Cancer progressed and spread despite various chemo regimens and a clinical trial. We, orthopedic surgery, got consulted to assess if it was safe for him to walk, do physical therapy in the hospital with the bone lesions, and possibly put metal rods into his femurs to strengthen them and allow him to walk. 2 days later, he had a massive stroke involving 60 to 70% of the left side of his brain. In a matter of hours, This poor guy went from having terminal metastatic cancer, to also being paralyzed on the right side of his body and being unable to speak, aphasia. Surgeon. I was repairing a self-inflicted gunshot wound with unknown history. I take face trauma, so it's not an unusual call. However, I couldn't make sense of the anatomy. He had shotgunned the roof of his mouth and cornflaked his palate and maxilla, but typically you can piece it back together. I soon came to the realization that it wasn't normal anatomy. He had a giant squamous cell carcinoma tumor infiltrating and eradicating his palate and maxilla, and had blasted the tumor. Although he survived the gunshot, he would not survive this cancer. There are a few things worse than death, amongst them is uncontrolled head and neck cancer. You lose the ability to taste, eat, talk, smell, breathe through your mouth, with the exception of the taste and smell of your own purulence and fetid tumor, accompanied by perineural invasion of the trigeminal nerve leading to severe pain, and eventual dementia and death. All the while you're disfigured and fear-inducing to others. He had just seeded it everywhere and removed any chance of palliative surgery and radiation. We did this man no favors by saving him. Also, getting the Gardasil vaccination can prevent this. Late and not a doctor, but I'm a paramedic and we were responding to a suspected drunk driving accident. The police arrested the driver. We were checking on the passenger in the back of this sedan that barely had a scratch on it, a fender bender at most. Dude is super out of it with a tiny cut on the back of his head. He is resistant to everything, getting out of the car, getting on the stretcher, assessing him, taking vitals, etc. He just closes his eyes and pushes us away. We tried asking him what happened to his head and we refused to answer. There's no way that cut happened from the tiny fender bender, it just didn't make sense. Anyways, we take him to the hospital, just another belligerent drunk. Right? So a few hours later, we check back in with the doctor to see what his blood alcohol content was. She says it was 0%. We say that can't be right, everyone in the car was drunk, the driver and front passenger. Turns out our patient actually had a basilar skull fracture and bilateral subdural hematomas and absolutely no idea how it happened. It taught me to assume there's a medical, traumatic cause to the patient's condition before assuming substances caused it. Ed resident at a quaternary care hospital. I'm nights on the PQ rotation. The fellow gets a frantic series of texts and calls. 7-year-old that had a dresser fall on them. Dresser was trapped behind a door so the family and EMS can't get into the room. Takes 20 minutes to bust down the door. EMS tells us they could hear the child screaming then suddenly go silent. Bilateral chest tubes in place and CPR in progress when the fellow and I get downstairs to the ED. Fellow intubates the child. First attempt failed with blood in the mouth, gets it on second attempt. We're able to get a pulse with adrenaline and rush to court. They lose pulses again in court and they're rushed up to the PQ. We deplete the PQ's entire stock of life-saving medications as we attempt resuscitation for what seems like an eternity. Fellow and attending go to speak to the parents and bring them in as I run the last 10 or so minutes of the resuscitation and ultimately pronounce the child dead. Something like 15 doctors and who knows how many other staff members were involved. This is a hard job. I'm a fourth-year medical student, but last year during my third-year clinicals, I was assisting on a surgery for a patient that was in for a suspected common bile duct cancer. Well, when we were investigating the size of the tumor and how much of the common bile duct was obstructed, my preceptor just stopped and slumped over after he realized the primary site of the cancer was actually in the gallbladder. We didn't even finish the procedure. It would have done more harm at that point, so we closed and prepared to tell the patient. Gallbladder cancer is extremely rare and the only treatment is palliative chemo. Essentially extend the good part of their life for as long as possible. The patient's prognosis was roughly 2 or 3 years.